In 2018, 3.2 million Australians lived with chronic pain. This is set to rise by 5.2 million by 2050. 44% also live with depression and anxiety. In 2015, Pain Australia reported 9.5 Australians had long-term condition, with the most common being arthritis and back pain, and affecting around 2 million people each. 20% of all presentations to GPs in Australia involve chronic pain. Medication are used is close to 70% of GP consultation for chronic pain management. But is there any other option to treat patients' pain and musculoskeletal or neurological condition without an invasive ways or medication or injection? Hi, my name is Farid. I'm the owner and senior physiotherapist here in Maryland's Rehab Center. I want you to stick around to the end because I've got something special that will change the way you treat your patients in pain in future. Laser is without a doubt one of the treatments which has revolutionized the way doctors treat patients, from doing eye surgeries to removing kidney stone or tumour. History of using laser goes back to 1951, and the first medical use was reported by Goldman in 1962. Without a doubt, medical treatment has been changed due to the new use of these technologies. But how laser is changing the world dealing with pain or musculoskeletal condition? As I know, health professionals are keen to know about research evidence, and there is lots of research happening around the world proving laser is good for this sort of issue. A systematic review done by Martin et al. In 2019 on efficacy of low-level laser therapy on pain and disability in knee osteoarthritis, and used only randomized controlled trial in their systematic review. And they found that low-level laser therapy reduces pain and disability in knee osteoarthritis significantly during treatment and also in the follow-up in 3 months' time, and no adverse effect was reported. Considering some adverse effects of a total knee replacement surgery, being blood clots, pulmonary embolism, wound infection, nerve and other tissue damage, bone fracture, dislocation, pain, stiffness, it's definitely worth it to try out low-level laser therapy before patient arthritis gets too bad to think about surgery and knee replacement. Dr. Roberto Chow was originally a general practitioner in private practice. Dr. Chow is focused solely on pain management and has used laser therapy to treat patients since 1988. She owns Quantum Pain Management Clinic in Castle Hill and done a systematic review in 2009 on effects of low laser level therapy in the management of neck pain. And she used only randomized controlled trial with placebo. She found that in articles that low-level laser therapy reduces pain immediately after treatment of acute pain and up to 22 weeks after completion of treatment in patients with chronic neck pain. Considering side effects of a painkiller being internal stomach bleeding, liver damage, kidney problems, high blood pressure, fluid retention, and stomach ulcer, it's definitely worth it to try low-level laser therapy before overdosing patients' painkiller before damaging other internal organs. Huang et al. Did a systematic review in 2015 on the effectiveness of low-level laser therapy for non-specific chronic low back pain, and they found that laser therapy is an effective method to relieve low back pain in patients who present with non-specific lower back pain. And also the American College of Physicians has recently included cold laser therapy in their clinical guidelines for patients with chronic lower back pain. But what about nerve pain? Is there any research evidence about that? Yes, it does help, and it has been shown in research. A research was done in Memorial Hospital, United States by Rader et al. On the effects of MLS laser therapy on nerve conduction parameters in developing diabetic sensory peripheral neuropathy found that MLS laser therapy applied to the tibial nerve and peripheral nerve in persons with documented diabetic peripheral neuropathy will lead to objective demonstration by nerve conduction study evaluation. A reasonable expectation is that this improvement in function will lead to improved sensibility in the feet. The great news is we have brought the most advanced technology and newest laser machine from Italy to here with a robotic head and 75 watts power, which makes the treatment time much quicker. And it is able to provide your patient with the best available treatment in the world. So if you have any questions, write them down and I will try to answer them personally. Until next time, bye for now.